Dr. Commiskey in Albuquerque. This is a patient who has fairly advanced keratoconus. You can see toward the right side of the screen there's actually a little bit of haze on the cornea, and there's some fine vessels there. That kind of kept us from considering doing that CTAC or CARES procedure where we try to reshape the cornea first, and the patient's vision is actually really very good with one of our scleral lenses that our specialty optometrists are able to fit. So what we're doing here is just cataract surgery because the patient does have a cataract. But the type of lens we're using is just a good old-fashioned monofocal lens. The advantage to this approach is that it gives good clarity, doesn't really add to the already abundant aberrations of the cornea itself, and it allows for the continued use of that very vision restoring scleral contact lens that the patient has come to rely on. So here, because the patient's cornea has so much power in it, I think it's a 55 or 60 diopter cornea. The lens power that we're using in order to get the patient to a prescription of -5 to match the other eye is actually a power of 3, just 3 diopters. Most of the lens powers, the average is kind of 20, probably from 19 to 23 diopters, somewhere in that range. So a 3 diopter lens is really quite low. We always want to use some kind of lens because it provides some stability in the eye and helps separate the back of the eye from the front of the eye. But 3 diopter power lens is quite low. So it requires a special injector. So that means just enlarging the incision just a little bit, which I think we're going to do right here. Yep, I tend to enlarge the inner aspect of the incision a little bit more. And then here comes the lens. It's actually a 3-piece lens, meaning that the haptics, the parts that stick out, are made from a different material than the optic, which is the clear circular center part that you look through. So there, we just put that in the bag. I use my trusty right angle instrument there to dial it in. Then we're just going to take out all the viscoelastic gel, seal up our incisions, and the patient's going to be seeing beautifully. Really happy with how that case went. Thanks for watching.